Well, tonight we know the White House is saying, quote, the bailout of insurance companies through these unlawful payments is an example of how the previous administration abused taxpayer dollars, end quote. Well, here in our state, getting rid of the subsidies will likely impact at least 70,000. We get that number from this letter to the U.S. Department of Health and Human Services dated April 11, 2017. Back then, Ron Sims with Washington Health Benefit Exchange Board wrote about the uncertain fate of cost-sharing reduction funding, saying it has a huge impact on our customers, as 70,000 of all individuals purchasing coverage on Washington Health Plan Finder receive CSR assistance. CSRs are discounts that lower the amount you have to pay for deductibles, co-payments, and co-insurance. So cutting subsidies means rates will go up in Washington. There's already a proposed 24% rate increase for 2018, and the state has said high backup rates will be implemented if CSR funding is cut to make up for the loss of federal funding. Well, earlier today, Senator Patty Murray sat down with our political reporter, Natalie Brand, and talked about the ongoing threat of the president scrapping subsidies.
The reason that insurance prices are going up double digits right now is because the president has been threatening that he is going to stop making what is called CSR payments that provide stability to the insurance market. So far he's made them, but now he's saying he's done. So insurance companies, when they look at their rates, know they're not going to have that, and they charge more for their policies. That's why people are seeing such huge increases. What Senator Alexander and I are trying to do is to assure that those CSR payments will be made so that the insurance rates will come down.
Well, with tonight's news, we're seeing some late tweets from Representative Pramila Jayapal. She represents Washington's 7th District and writes, the President of the United States is on a maniacal quest to make health care more costly for millions of people. Also hearing from Republican Congresswoman from Florida, Ileana Ross-Layton. She writes, cutting health care subsidies will mean more uninsured in my district. POTUS promised more access, affordable coverage. This does the opposite. Now, Speaker Paul Ryan tonight says Obamacare is a fatally flawed law, and the House will continue to work with the Trump administration to provide a better system. Live in the newsroom, Natalie Swaby, King 5 News.
Natalie, thank you for that update. Now, this latest announcement comes after an executive order the president signed earlier today, and that will make even more changes to the Affordable Care Act. The bottom line here, it paves the way for people to buy a skinnier or even like a smaller plan that doesn't cover as many things. So you could buy health plans as part of associations, small businesses, or even individuals.
This is going to be something that millions and millions of people will be signing up for, and they're going to be very happy. This will be great health care.
So the next important question is, who's it good for? Well, in this particular example, a healthy couple, let's say in their 20s with no kids who don't make a lot of money. Now, their policy would be cheaper, but come with higher out-of-pocket costs. Now, let's move on over to the other side of things. A couple in their 60s with higher medical expenses would pay more because fewer healthy young people would be within their particular insurance pool.